We have breaking news. The CDC Advisory Committee has just voted to stop recommending the hepatitis B shot for newborns. The move reverses a public health policy that's been in place for more than 30 years. Committee members delayed the vote yesterday after disagreements and confusion over the voting language. Now the panel's recommending parents decide whether newborns need the vaccine based on the mother's testing status. Let's bring in former CDC Chief of Vaccines and Respiratory Diseases, Dr. Dimitri Dakalakis, for more on that. Doctor, thank you for coming on. I know you worked closely with this committee before resigning from the CDC this summer. At the time, you said Health Secretary RFK Jr. and his staff's views challenged your ability to continue in the role and serve the health of the American people. So what's your response to this vote now?
Yeah, I would have quit today, just like I quit a few weeks ago. I think that what you're seeing is ideology supplanting science, conspiracy supplanting process. And what's happening is that there's been a vote that's conducted that really doesn't change very much. Access remains the same, but creates doubt, confusion, and will result in more children getting hepatitis B. And ultimately then getting chronic hepatitis B, 90% of them will if they're infected, and 25% of them will die early. And so, as one of the ACIP members said, this is harmful, and this committee is going to be responsible for that harm and needs to take that responsibility.
So the previous recommendations were to give the Hep B vaccine at birth and then do the typical 3-dose series and finish that by 18 months of age. Public health experts have long warned that kind of softening those recommendations would lead to an increase in infections. So what do you think these new recommendations mean for parents?
So, I mean, for parents, it just means confusion. So I would say that the most important lesson from the ACIP over the last few months is don't listen to the ACIP. I think that you have the American Academy of Pediatrics, the American College of Physicians, the list goes on, who are actually clinicians that practice, that are very clear that this vote was something that will actually result in harm to children. And so what parents should do is talk to your pediatrician. Do not listen to the noise, focus on the signal. And we know that this vaccine has a very favorable risk-benefit ratio. So why are we messing with something that is both safe and extremely important in preventing terrible complications in children? So that's what I would say. Talk to your doctor, talk to your pediatrician. Don't listen to these guys.
Supporters have said that Hep B is primarily spread through sexual contact or sharing needles, which obviously no newborn is doing. And so the other concern, obviously, is whether the mother has it. So why not base it on the testing status of the mother?
Right. So history. So it is a very interesting theoretical conversation. But if we rewind to history, universal strategies to test people who are giving birth have ended up not being the way that we drove down hepatitis B infections in children. It was the combination of more than one thing. It was testing and also a universal dose recommendation. I think that one of the most important things said at this meeting is that the U.S. is not Denmark, right? They're comparing the U.S. policy to a policy of a country with universal health care where people do not fall through the cracks, and that is not us. And so this is really about the individual health of children, and that is really being compromised, not so much by the vote, but by the discussion that is creating havoc and confusion. This is a chaos agent who has selected this ACIP committee. That's the secretary, and they're just working in his image.
What will this mean for insurance coverage if parents do want their baby to get the newborn dose, even if the mother is negative for Hep B?
Right. So they didn't change anything. So that's what's so interesting. Like, this vote is kind of irrelevant. The next vote, which is about the serology, like using testing to figure out how many doses a kid should get, that's going to be very important. What they voted on technically is talk to your doctor about whether your kids should get a vaccine. That happens anyway. So this is just a lot of sort of propaganda using words that frankly the committee doesn't really understand, to just make the point that they're appeasing a group of people that really feel that there needs to be more personal choice. Newsflash, there already is personal choice. And so that's why this is so strange.
So, doctor, if nothing is actually changing here, why is this so controversial?
Yeah, so it's not about the vote, right? Right. The vote that hasn't changed access in terms of coverage. It's about the fact that they've created this thing called, individual decision making, which is what every vaccine is. And what it does is, to a doctor, it really signals confusion. What it means is that people will say, is there something wrong with the vaccine? Does this create a liability risk for me? And so anything that's not really clear creates confusion. And I think that for anyone who's been watching this ACIP committee, clarity is not the thing that's going very well in the room. It has been chaotic. People don't understand what they're voting for. They've had to change the voting language 3 or 4 times. So I think that the bottom line is that it's more the soft universe of confidence in the vaccine and the confidence of clinicians to offer good advice to parents that they've impacted. So it is a very bad day for vaccinology, immunology in kids in the U.S.
All right. Former CDC Chief of Vaccines and Respiratory Diseases, Dr. Dimitri Daskalakis, we appreciate your time today. Thank you.
Thank you very much.